Well, good afternoon, everyone, and welcome to you. I'm Denise Johnson, the Physician General at the Pennsylvania Department of Health. I want to thank you, Patrick Bradley and Jeannie Goldstein, who are here today. Thank you, Central Blood Bank, and for all of the staff for hosting this event today. With COVID-19 and other illnesses really impacting blood donors going on 2 years now, we find ourselves in a very difficult position with a very, very low blood supply. Many schools and workplaces have students and staff that are out sick, and they have had to abruptly cancel blood drives and haven't been able to reschedule. This time of year, with the changes that we've had in the weather, with colds and flus circulating, people have found it very difficult to get the blood donations done that they have done in the past. And it has really impacted our blood donation centers. The blood donation shortage is not only a problem here in Pennsylvania, but it's an issue nationwide. Blood donations are a critical and integral part of medical care. If you and your family member have an accident or need a procedure, you might need a blood donation. Blood transfusions are used for many people who have major surgeries to replace the blood that has been lost during their procedure. But it's also used for people who have other illnesses like anemia or blood disorders or kidney diseases as well. And we need all types of blood to have a reliable blood supply for donations. But even in this blood shortage, there is hope. You can save up to 3 lives by donating just 1 pint of blood. And you can make a difference. Right now, the department has updated our website with resources that can tell you where you can donate blood, if you're eligible to donate blood, and then also external links to tell you more about the process. You can donate blood up to every 8 weeks. And for individuals who are recovering from COVID-19, per the FDA guidance, if you have been more than 10 days after your symptoms, you are able to donate blood. You should check with your local blood donation center where you're about to give blood to make sure that you meet those requirements. But the requirements to donate blood are very, very simple. If you are in good health, 16 years old or older, and weigh at least 120 pounds, you can donate blood. In addition to the Central Blood Bank here, where you can donate, the other blood banks that serve the Commonwealth include the American Red Cross of Greater Pennsylvania region in the Northeast, Community Blood Bank in the Northwest, Miller Keystone Blood Center in the South Central, and Vitalant Blood Center in the Southwest. And if you're not near one of those major blood centers, go to the nearest donation center or go to a blood drive to give blood. Individuals can donate, again, I said, up to every 8 weeks. We need a lot of blood supply right now because we're really quite low. So I want to thank all of you for your attention to this critical shortage. Please consider donating blood. And right now, I'd like to turn it over to Patrick Bradley from the Central Pennsylvania Blood Bank to discuss the critical need for blood donations.
Thank you, Dr. Johnson. And thank you, everybody, for coming out today. We really appreciate it. My name is Patrick Bradley. I'm the president here at the Central Pennsylvania Blood Bank. And I just want to speak to some of the interesting things that I'd like everyone in the Commonwealth to know and understand, perhaps. On a daily basis, to be successful, we need to see about 250 individuals that reach out to us and are willing to donate blood. As Dr. Johnson said, we are struggling mightily. I've been in blood banking for more than 30 years, and this December and January period were probably the roughest couple of months that I can remember. At that point, we were only able to supply our hospitals with 70% of blood, 70% of the units that they requested, and we thankfully are starting to see a bit of a rebound in donations, but we're still not out of the woods yet. We still need people to come out and donate. One of the other interesting facts that I'd like to share with everyone is a few months ago, we were a founding member of the Blood Emergency Readiness Corps, abbreviated as BERC. And that is a group of blood centers across the United States that reserve blood in the event of a national disaster or national emergency. So if you recall the school shooting out in Detroit a few months ago, or weeks ago, we sent blood that day to Michigan Blood Center so that they could treat the patients, the victims of the shooting. So it's a very vital part of what we believe that we are trying to do, not only in Pennsylvania, but for the entire country. So just to keep that in mind. And then finally, I was asked to just provide some numbers. We need about 75,000 donations per year, and that's just for our region. We service 21 hospitals, and we're pretty busy. So I don't want to take up any more of your time, but I would like to introduce Jeannie Goldstein, who is going to share her personal experience as a blood transfusion recipient. Thank you, Jeannie.
Hello, everyone. Thank you, Dr. Johnson and Patrick, for having me here today. And thank you to everyone who has given blood, or I wouldn't be here to tell my story. It was a year ago, February 22nd, that I went to Hershey Medical Emergency Room with gastro issues and was diagnosed with acute myeloid leukemia, AML. Wow, unbelievable. It changed my whole world. I didn't know what to do. It was brand new to me. I had no family history, no past symptoms. For 17 days, I was on the 7th floor cancer unit at Hershey Medical with great nurses and staff. Dr. Zhang and her amazing team started me on my first round of chemotherapy and blood thinners because I had blood clots that had started all over. While in the hospital, I got 5 units of platelets and 6 units of red blood cells. Chemo kills everything. It kills your good blood cells, it kills your bad blood cells, and it depletes your blood supply. I needed blood support. I got out of the hospital, and for the next 8 months, I went to Penn State Cancer Institute and did 5 more rounds of chemotherapy. The last 3 rounds were the strongest. I received 13 units of platelets and 10 units of red blood cells, and overall 30 transfusions. Sometimes I only got half a dose because of the shortage. Luckily, my body responded well to the chemotherapy and the other treatments, and I am in deep remission, and I see my doctor once a month. But there are others going through cancer and other rare diseases that need support more often, and then the everyday accidents and surgeries that go on. It is a need just as the air we breathe and the bread and milk you need to get during a snowstorm. We need people. We need you. We need your blood. It is so precious. I'm so grateful. I'm so grateful to the blood bank and how easy it is to set up a blood drive. I've had 2 blood drives and got this great t-shirt. Go Team Jeannie. And Johnny Love and his team made everybody feel really comfortable. My brother had a blood drive in Perryville, Maryland. Every community can help. Every community is in need. It is right there, an arm away. Please give. Thank you. Thank you.
Wow. Thank you, Jeannie. Thank you for being here. And thank all of you blood donors who donated and saved Jeannie's life and saved the life of so many others from donating. And those of you who haven't donated yet, you have an opportunity. So please consider giving a blood donation today. Thank you. I'll be happy to take questions for any of us up here.
You touched on this, but can you talk about the reasoning why you are seeing, when people tell you not going to volunteer to come in, or they feel worried about it. Can you guys elaborate a little bit on that as far as why you're seeing people say, I'm going to pass on this?
Well, I think earlier in the pandemic when we didn't have vaccines and, the way that we gave blood before, you're coming into an enclosed space. I think people were concerned about that. And also staff are certainly concerned about being in close proximity to people who could be infectious. I think now that we have vaccines and now that all of our blood centers have put processes in place to keep people safe, then that risk is much, much lower. But I think that people still need to be educated on the fact that we take a lot of precautions and certainly don't want people to come in when they're ill.
So the message is it's definitely safe to come back.
Absolutely, yes.
I just had a question for Patrick, if I could.
Yes.
You mentioned you need 270 a day, is that what you?
250. We'd like to see
How many
250 a
a day?
donor. I can tell you that in December and January, the beginning of January, we may have been seeing about 120. So less than 100 where we really needed to be.
So less than half of what you actually need.
Correct.